It's been recognised that there's multiple factors that impact on why people develop dementia. Aging is the biggest risk factor that we know of. It's now growing evidence that there's actually other factors that are at play. So blood pressure, diabetes, cholesterol, so the bad fats that are in your diet, being less active, social isolation, smoking, alcohol, and actually as you get older, issues with vision and hearing have also been shown to impact development of dementia.
There's no guaranteed way of stopping dementia from happening, but there's certainly ways that you can prevent the symptoms for significantly longer.
About sort of having a healthy diet, trying to reduce your smoking and your alcohol if you can, making sure that your blood pressure is well controlled, thinking about getting cholesterol checks in your middle age, and as you get older, making sure that you're trying to be as socially active as you can.
Being socially isolated can have a real impact on your mental health and therefore your physical health.
There's so much in Netherton to address social isolation.
I've known about this place yonks ago, because I helped set it up going many years ago. I sort of had an affinity to it, I really enjoy coming here, and I think we all enjoy it, which is a good thing for elderly people.
Social stimulation has been shown to sort of reduce the risk of getting dementia later on.
Getting out and about, walking a little bit more, gentle exercise, especially started from a much younger age, can really help.
Early signs and symptoms can often be quite subtle. Struggling to remember places or conversations or recent events, sometimes changes in mood or your personality, or even in your confidence.
To begin with, it will be just little things, like perhaps forgetting names, forgetting appointments.
We'd sit down at breakfast and I would say to her, "What day is it, Mary?" And then she would go through them all to guess. She just didn't know.
He never ever told a lie, and he started telling little bits. I thought, what's going on here?
So if you recognise any of these in yourself or even in your family members, having a chat about it is quite useful.
A lot of the care navigators, receptionists that we do have been with us for a very long time. We make sure all our receptionists are trained in some kind of dementia awareness.
If people aren't quite ready to go to the GP yet, the community centres, to the L30, the Feel Good Factory are absolutely paramount for the community to come and ask for help and just have an informal chat. Someone holding your hand through the process.
I would say she got 5 years of semi-independence from taking that medication. It really did help.
If you're concerned about your memory, that's a significant reason for them to see one of us. Don't feel that you're wasting anyone's time.
We've had some bereavement in the family, and we just thought it was part of grief. We now been so hugely hyper-independent before. We were probably quite naive, to be fair, as to the journey we were just beginning.
With something like a memory issue and a worry and a concern with that, we like to make sure that they're put in with one of our GPs so that the appropriate tests are done and the referrals done within our surgery itself.
We receive most of our referrals from the GP. It will be screened on the same day that we receive that referral just to see if it's urgent. If it is urgent, then the referral will be reviewed on that day. If it's just a routine referral, then it will be reviewed as part of our triage meeting. Our target is to see the patient within 4 weeks.
All of our memories as we get older will decline. For some people, memory can start declining to a point that it impacts upon your day-to-day functioning. That's the point when we might look at kind of diagnosing a dementia and getting you on some treatment. The assessment is quite lengthy, so it's usually around an hour and a half. We take it at the patient's pace. It's more like a discussion.
So we went for an appointment to the memory clinic, and that was when she was first given a diagnosis that it was early onset dementia. Put a label on it and acknowledge it is dementia, and acknowledge that it is an illness, and it's not something to be ashamed of, and it's not something to shut the door on, and it's not the end of their life. It's just going to be a different kind of life. But you know what? Different's okay. Talk about it and embrace it.
Yeah, I would definitely say early diagnosis helps.
It's hard for anyone to make the first step. We always say you are not wasting time. You are as important as every other patient.
We try and make our practice dementia friendly. We need the receptionists to be understanding, that they take the time to listen to that patient.
You get caught up on the conveyor belt of taking care of someone or trying to be their rock. Get support for yourself. As much as that person's living with dementia, so are you.
Dementia Friendly Netherton is based around our community hubs. They see elderly residents every day, and they're the first people that the community goes to for support, help and advice.
Don't be ashamed to go out. Some days you think it's easier to stay in. No, it's not. Get out. Keep being part of your community.
I'd never had any connection with dementia before until Emma's nan. She used to often tell stories, about her family in the past. And she was getting the story straight, but she was getting the people mixed up, so she gives somebody else's name. I never corrected her. That's all I could do was offer support. Try and understand when they're talking to you and you don't recognise it. It's not their fault. And you sort of have to take that in your stride.
Your wife would say to you, Nicky, it's tragic that this has happened to your dad, but you've got to look after yourself as well, your own health. I was out the front of my house one day, painting the front fence, and he couldn't walk past. And the other thing it was Brian back here. You've missed a bit there. When he was gripped by this thing, you just walk in, sit on the couch, and just stare out the window.
Somebody has been diagnosed with dementia, they've been started on treatment. We'll see initially after 3 months. Yeah, if the patients or the families have any concerns, they can phone us up, speak to a duty nurse who's on shift that day.
It's about some of those small acts that you can do to support neighbours and people around you. One of our local community groups is crocheting these flowers to give out to people so we can scatter forget-me-nots all over Netherton. So it's about communication, really.
Within the Feel Good Factory, for instance, and I know other centres do the same thing, we're always here to support people, hopefully be able to hold the hands of the carers as well as the person going through it.
We sort of just rode the dementia ride, really. Each day was very different, as was hour by hour. She went from being such a patient, kind, loving, caring lady to be quite short-tempered. You have to try and enjoy the funny parts of the journey. The keys were the massive part of life, because if she had them keys in her hand, she was off. They were like her little safety object.
Emma liked to decorate, the garden for Christmas. And when I'd gone, and Nan said to her, "Oh, you and the man from the council have done a cracking job on the garden." She thought I was from the council. She didn't recognise me.
But they prescribed the medication and we got her a sheltered accommodation. She started that medication in August. She was the life and soul of that place at Christmas. Absolutely. That medication made such a difference to her. She was engaged with everybody in there. She was helping with the parties and afternoon teas.
Living Well Sefton is public health funded, so we are able to offer a variety of health and wellbeing sessions.
It just feels like everybody we've spoken to in the community has a dementia story. If we can raise that awareness, whether it be a cafe or a shop, so people can go out with their relative or on their own and feel safe in those spaces, and I think that's what making Netherton dementia friendly is all about, really.
Feel Good Factory in Netherton is one of our healthy living centres. We have mentors there. They can do one-to-one support to address any healthy lifestyle issue that they've got.
This is what a lot of people do. They just assume it is dementia, and it may not be. But if it is better to know sooner rather than later.
There's also places like Health 30 Centre, Netherton Park Community Centre, lots of courses and programmes that are offered throughout Netherton, lunch clubs, knitting clubs, there's gentle exercise sessions, there's a community garden, lots of stuff that would address social isolation to really integrate you within your community.
If you have the help that you need at an early stage, you are able to cope much better and to make the person you're caring for, make their life easier. And help them to enjoy life, because people with dementia do enjoy life.